Fatigue is one of the most common symptoms after a neurological condition. Fatigue is sometimes really misunderstood by relatives, the patients themselves, and also sometimes clinicians. Until fatigue is really experienced, it's quite difficult to say exactly what fatigue might be for an individual. Fatigue does impact quite a lot on somebody's quality of life and function. It's one of them invisible symptoms that you need to really explore in lots of different ways before we can make a clinical decision of how we kind of interpret that fatigue. So the difference between being tired and having fatigue can be seen in quite close ways, but also completely the opposite. So a nice example of when you're feeling sleepy and being tired would be after you've had a large meal and you're quite warm and you're cosy on the sofa and you feel like you could just drop off to sleep. Whereas being fatigued is when it's a lot more on a deeper level. So when it's in your bones and into your muscles, you physically can't get past that barrier to do anything. So you might not even be able to go to sleep. So that's what fatigue is, and that's the difference of when you're tired and when you can say you generally are fatigued. There is normal fatigue. Normal fatigue gets better with periods of rest, and there is abnormal fatigue, which is also pathological fatigue. So that doesn't get better with rest, it's a longer period and it's a lot more strenuous on the body and the mind as well. Okay, there's also central fatigue. Central fatigue is more of a direct result of a neurological injury, and that's related to the neurological transmitters within the brain. There's also peripheral fatigue, which is mainly directly related to the muscles of the body. So that's how we differentiate the difference between the different types of fatigue under the umbrella term. So fatigue can be seen as an umbrella term with lots of different symptom clusters. Fatigue is also very subjective and can involve being physical and mental and have an impact on the individual with their usual and also desired activities. The fatigue is regularly reported but very poorly understood, and even now the measurement and management for interventions is quite inadequate and there's a lot more room for evidence to be made. Fatigue poses one of the greatest barriers to rehabilitation because they can't really participate within the rehab because they're so fatigued to try hard. It also affects their quality of life and the intervention we can provide for them. The lack of understanding about fatigue can pose a real strain on the individual and their relatives. I think to help that we need to provide more education on how relatives can help manage the fatigue. Fatigue can decrease information processing speed within an individual, and that leads to mental fatigue, and it just makes it a lot harder for them to make decisions and continue on with their rehab. Fatigue can be linked with poor attention, anxiety and also depression. With vitamin D deficiency, and also be linked with pain after their neurological condition. So one of the activities I regularly use to assess someone's fatigue is the fatigue gingerbread man. What the fatigue gingerbread man is a visual way of showing somebody's fatigued. Rather than trying to get them to explain their fatigue via words, which can make them more fatigued, let's try pop it on paper. One of the things I like to see when someone's fatigued is to get all of the senses. So what do they feel, what do they hear, what do they sense, what do they taste, and just kind of see that in a picture form. People are able to describe things better rather than give you the exact answer. So one of the things I'd like you to do is to have a go at the gingerbread man, see how you can manage it. So tell me how you can sense things when you're fatigued. How do you see things? What do you feel? How do things kind of act in your ideal world of being fatigued, and what things do you want to cancel out? Put them on paper in a visual form, write them down in any way possible, and just try to get across how fatigue might feel to you. Now stop. Does your gingerbread man look similar to mine? So on my gingerbread man, I've said I felt hot and weighed down. What might it feel like to feel weighed down? Some people might assume that verbally is just feeling quite heavy and to the floor. Whereas weighed down for me feels like having weights on your hands, weights on your legs, not physically being able to pick them up. So that's how I've symbolised that on my gingerbread man. Feeling hot, I've kind of expressed that as having the sun above your head. I was like, it's not hot on your head or a particular area, it's all over of when you can't get out of that sun and you're just physically stuck there. So there are many ways that you can describe fatigue just by looking at the gingerbread man. So now you have a visual way of showing your fatigue and also trying to get the visual way of someone else's fatigue, a bit more into your head so you could be in their shoes. Fatigue can affect your cognition in many different ways. It can affect your cognition with multitasking, so you might not be able to dual task as much as what you might be able to in the past before your injury. It can also affect your attention, so you might feel that you're drifting in and out of the task you're meant to be doing and you're not quite able to focus as much as you used to, which then can lead to risk of safety and not actually managing to plan your task effectively. Fatigue can also have an impact on sustaining your performance, which then can lead to anxiety, depression, and also fear of being able to do the task in general, which then will affect your quality of life as you'll be more dependent on others to do the tasks for you. Cognitive factors can also have an impact on your environment. If you're not able to cope within your environment, we have to do lots of different environmental strategies. So having fatigue can affect that, as you may not be able to keep up with the environmental strategies we pop in place. So environmental strategies we can pop in place maybe pacing, so making sure you've got chairs to sit down in the relative places. For example, in the kitchen, if you're cooking a meal that might take 20 minutes, that might be a usual meal time for you. However, after an injury, that can seem like a long time. So making sure you've got a stool in the kitchen to sit on while you're making that meal so you can have a rest when needed. Also pacing the activity, making sure that throughout the house you are having regular resting times, the regular lighting's in place so you're not in a dark room all day, because dark rooms can make you feel very tired as well. So make sure you're in bright environments throughout the day. So there are some of the environmental factors we can ensure that are in place for you. So one of the things as practitioners we look at is the client's presentation due to their fatigue, or is it due to maintaining their arousal within the environment? In terms of arousal, one of the things we look at is someone constantly seeking sensory stimulus. And another thing we might look at is, are they needing more sensory stimulus to keep them going? So we have to first find that out before we can then decide what's best intervention for them. So I like to call these sensory seekers or sensory sleepers. So in terms of a sensory seeker environment, in the real world that would look at busy supermarkets, open offices, hospital wards, activities such as swimming pools that have quite a lot of people, parks. So things like that's what I would class as a sensory seeker. In terms of sensory sleepers, people would need quiet rooms, dark rest period times with no stimulation such as TVs going off, nice quiet countryside, quiet parks, so away from all the real busy environments. When identified whether someone's a sensory sleeper or a sensory seeker, that can help manage fatigue. For example, if we find someone that tends to be in a dark room all the time, we'll tend to change that stimulation, as being in a dark room and quiet periods might make you more fatigued. So it's a trial and error period, but it's something we do to try and help find what sensation is best for you. Fatigue is very individual to the person. Sometimes with basic sleep hygiene, we can manage to help that fatigue. It might take a few weeks, it might take a few months, but on the other hand, you might have an individual that no matter what interventions we pop in place, they still might have that fatigue years down the line, and all we can do is try and manage that fatigue as best as we can for that person. Sometimes people will always have their fatigue, and all we can do is try and make it as comfortable for them as we possibly can. Medication might be the only answer. To kind of conclude sensory processing, fatigue does need close task analysis. So that involves looking at each task from getting up in the morning to getting washed to making your breakfast to even opening your medication bottle, and kind of finding out what part of that task is difficult for you and what we can do to make that better. And it also needs quite a lot of focus on the sensory processing needs and demands as kind of an overall umbrella term to help manage that fatigue. There's not one single measure of fatigue. Fatigue can be managed in many ways. One of the ways it can be measured is through clinical scales. So that's giving the individual a piece of paper with lots of different scales on and getting them to self-monitor their own fatigue. Another way of managing fatigue is through clinical observation, so through observing somebody in a natural environment and then making notes on what we see as individuals might make them tired, and then kind of having that discussion with them to see what they feel makes them tired, and then popping them together and see if there's any correlation that we can then action plan on. Fatigue can be observed in many ways through task analysis. It can also be measured with activity logs, video observations, in-house rehab observations, personal self kind of exploration, diaries, and also observations from family and friends. When we're looking at fatigue, we have to kind of realise what fatigue means to the individual, because what it might mean to me might be what it might mean something different to you. So we kind of have to realise that we are talking on the right page. So just because I say fatigue is this, you might see it in a completely different way. So we work with that. We're not here with all the answers, so we do trust your responses and work with them. In order to be able to cope and manage with fatigue, we must first be able to recognise it. So we try to ask the patients to try and recognise it themselves first. That can be difficult for patients to recognise, as they might not have internal body awareness. Some people might not have that awareness because fatigue might feel so normal for them. It might not be something that they're used to feeling. So as clinicians, it's important that we must also recognise fatigue, and we must not just dismiss it as laziness. Even though we feel that's something we definitely don't do, it's something that's always unconscious in our minds in terms of engagement. So in terms of recognising the fatigue, it's something we must always rule out initially and see how we can monitor that fatigue. It's also important that families recognise fatigue. Some families may also be the same as clinicians and think it might be laziness. However, that's one thing that clinicians must always do, is communication. We need to communicate with the families to ensure they understand what the fatigue is and the best ways for them to manage it. So that's just from understanding really. It's the same as the patients. You need to be able to understand that fatigue first. In supporting fatigue, after recognition, we need to do activity logs, good sleep hygiene, pacing, lots of rest periods, and education. Education around fatigue itself and what is fatigue. Once we find out what the fatigue is, we then can start fine-tuning really what it is we need to manage. One of the things we need to do to manage fatigue is to ensure the patient has good sleep hygiene. Sleep hygiene can be put into many categories, but as a simple way of explaining it, you need to go to bed at a particular time, not staying up till 2, 3 in the morning watching films, so making sure all stimulation such as TVs, radios, mobile phones are kind of switched off and put away, so there's no temptation to stay up with them really. Once they're kind of all switched off and you've got a regular routine of going to bed, hopefully you'll have then a regular routine of a set amount of hours sleep and getting up in the morning. Try not to have caffeine before a certain time in the evening, and also in food as well. Try not to have sugary foods and drinks probably before about 8 o'clock in the evening. However, doctors, consultants and nurses will be there to help you with the sleep hygiene and getting in a regular routine for you. Other things to help manage fatigue can include exercise. Regular exercise helps burn off all the calories we use in the day, and it also makes us tired enough to go to sleep. Good nutrition, good vitamin D, lots of outdoor kind of breathing, relaxation, meditation, being aware of our internal selves as well. So doing mindfulness does help with fatigue. So mindfulness is normally done within a group or individually. It's about focusing internally on yourself, focusing internally on your breathing, your awareness, what's going on around you. Once you can cue in to yourself, you're more likely to recognise fatigue and kind of the implications it does have on you. Other ways to manage fatigue are medical intervention, cognitive strategies, so using cue cards, timetables, alarm clocks, anything really that's going to stimulate your mind and help with that fatigue of the cognition. And environmental strategies, so not having a cluttered workspace, having everything tidy, labelled if necessary, just so it's quite easy to work within and not fatigue you that way. And also psychological strategies, so things to help with your anxiety, your depression and mindfulness. So if we're not able to do it as a team, a clinical psychologist will be able to help you with that. Medical interventions that can help with fatigue are medications that can help stimulate you in the day or to regulate your hormones. So in conclusion, overall, fatigue is very, very complicated. In terms of fatigue, we must target interventions that are individual to everybody. So one thing that might work for you might not work for your best friend. So we need to make sure that when we are sharing our management of fatigue, to realise that it might not work for everybody. When we're managing fatigue, we must also realise that it's not a quick fix. It might help you next week, it might help you next month, but you might also need the management for the rest of your life. So that's not always a negative thing. You might always get some good strategies that you find once they're in your routine that you won't ever notice them again. So we do say life strategies, but not to kind of brought down by that fact. They're something that's quite a positive thing.